great idea, I think, initially over coffee.
Yeah.
And then we said, this really needs to be done for New Zealanders.
My name is Jay. I'm a lecturer at the School of Pharmacy at the University of Auckland.
Hi, I'm Dr. Amy Chan. I'm a Senior Clinical Research Fellow at the School of Pharmacy at the University of Auckland. This was a really key study for New Zealand, as it was one of the first studies to really describe the rates of opioid use in New Zealand. Not only were we concerned about what rates of opioids were being used within New Zealand and how we compare to overseas, we really wanted to see what these rates were in people with surgery and trauma post-hospitalization, and how many of these users remained beyond the safe period of being on opioids. What we found were the rates were 1 in 11 patients post-surgery and 1 in 7 patients post-trauma had persistent opioid use.
So persistent opioid use is a nuanced term that really describes ongoing opioid use around 90 days beyond the actual event, such as surgery, or in our case, hospital discharge.
It can have harm in terms of increasing the risk of adverse outcomes, for example, increasing risk of hospital admissions, increasing the risk of addiction, and also side effects, as well as impacting things like work and quality of life. We found the first data around what the rates of persistent opioid use are after surgery and trauma in New Zealand. So whilst we know the what, the next step for us is to understand the why. So why are we seeing these particular rates, so that we can inform the how. So interventions on how to design effective ways to reduce persistent opioid use. So really, if you are prescribed opioids during surgery or trauma, or you know a family member who's being prescribed opioids, one of the key things we would like you to be aware of is that there is a safe period of being on opioids. And if your pain is improving and you're still remaining on opioids, it's important to have that kōrero with your whānau, your conversation with your clinician as well, to see, do you still need these opioids in the long term?